But here's the rub, and this is what the book is about. The book is about finding out by just reams and reams of data that even if your explicit preferences are egalitarian, even if your explicit preferences are to be a fair, non-prejudiced, egalitarian person, your implicit biases trump your explicit preferences. Your implicit biases, what is stored in your social knowledge, will do more to inform and direct your conduct than will your explicit preferences. Why is this important? It's really important in healthcare, and why I came to write this book was because health disparities, what we politely call health disparities, is killing people of color daily. It's causing people of color in this country to live sicker and die quicker because of the color of their skin. So if I were so inclined, I could spend the rest of the evening running the data on just that fact. In 2003, the Institute of Medicine published an important seminal work called Unequal Treatment, and it cataloged 25 years of data. The fact that infant mortality in the African American population is twice that of white populations. The fact that you are 75% more likely to die if you're diagnosed with coronary artery disease than if you're a person of color than if you're white, right? And these are the kinds of data, the kinds of statistics that will be replicated no matter what the leading cause of disease is. It's true for stroke, it's true for diabetes. I'm gonna pause at cancer because I wanna make a point. So with respect to cancer, whites and blacks diagnosed at the same time have a 33% difference, gap, in their 5-year survivability rate. This is not true, however, if they receive similarly intensive treatment, education, screening. If these treatment disparities are eliminated, then the difference in survival rate disappears, right? The fact that that is true is morally untenable. That's my first M. That is morally untenable in the United States, in my view. It is medically untenable because the medical profession not only agrees to first do no harm, but if you read closely, the Hippocratic Oath talks about justice. It talks about being a provider and a treater of an entire patient, a whole patient in context. And when that is not the case, then implicit biases change the way that people are treated.